Hello, everyone, and a warm welcome to our first ever Ask Me Anything session for TechNet. We're thrilled to kick things off with our experts who are here to share their insights on effective vaccine management, also called EVM. We'll be taking your questions live for the next hour, so please feel free to type them into the Q&A box. There's a chat, and I see we already have some of you who are introducing yourselves, so please go ahead. I think some of you know our panelists. So yeah, tell us who you are, where you're based, say hi, because this is an interactive session, and we would like to know who's with us. Um, so please use the chat box to introduce yourself, but also if you have any technical issues, like you cannot hear anything or don't see the screen, or yeah, just let me know and I'll be here to help you as much as I can. For your questions, just to help our moderators and our experts to find the questions more easily, please use the Q&A box. It's available at the bottom of your Zoom window. You can ask your questions at any time, and our experts will answer them orally and perhaps even in writing during this session. If while one of our experts talk about something and you would like to ask questions about what is being discussed, please don't hesitate to raise your hand. If you raise your hand, you'll be given the possibility to speak and interact with our colleagues and, engage in a discussion. We don't have interpretation today, but we're looking at doing other sessions in other languages later in the year. This session is recorded and we'll share with you next week, or perhaps at the end of the week, the links to the video as well as audio. And we hope to have also some of the questions and answers in written that we'll share also by email. Dan Brigden will introduce you to our experts in a few seconds. So I hope you'll enjoy this session, and I'll give the floor to Dan. Dan, go ahead.
Thanks, Alex. Hi, everyone. Welcome to this first ever Ask Me Anything. I'll just introduce myself and then pass over to the other panelists. My name's Dan Brigden. I work for WHO HQ here in Geneva. I'm technical officer in the vaccine supply chain and logistics team. And I've been working on the EVM2 initiative since we've kicked that off in 2017. I'll pass over now to Olamide.
Thanks, Dan. Olamide Folorunso, and I work at UNICEF headquarters and supporting countries and regions with the EVM and the cIP processes. And good to be chatting with everyone, familiar and otherwise faces. Thanks. I'll pass it on to Erida.
Hi, everyone. My name is Erida Naylor, and I'm working as an immunization supply chain consultant for UNICEF ECARO. But in this webinar, I'm here as a consultant doing EVM assessment in the countries, starting from the first ones in the history and then EVM1 and now in EVM2. So happy to answer all of your questions.
And Zainab.
Good morning, good afternoon, everyone. This is Zainab Berry. I'm a vaccine management specialist. I have been working with EVM since maybe 2011. I work as a consultant for both UNICEF and WHO. I have conducted more than 19 EVM assessments using the new tool and maybe 13 using the previous one. And it's a pleasure to be part of this panelist. Thank you.
Thanks, Zainab. Okay, so as you've seen, we have a great panel today full of many years of experience. Before we get started on the questions, and we have a number that have been pre-submitted. If we don't have any more coming in now, we'll move straight to those. Just have a couple of introductory remarks before we set out. I think I'm very interested to see how this format of online event pans out. I think because it's Ask Me Anything, you're not going to be seeing any PowerPoint slides coming up. It's more, it's very conversational in tone, and we're very interested to hear from you, what your questions are, and also your opinions about what problems you might face, or what you don't understand, or pain points, or how we can improve the EVM and cIP tools. And as Alex mentions, apologies for not offering interpretation services for this event, but we will be looking to do this session in other languages later in the year, probably starting with French in the summer. I think the first sort of observation I have is around the format of this session is quite interesting, because it's open to absolutely any question, and therefore I'm intrigued to know whether you're all going to be asking very advanced specific technical questions about EVM and cIP, or whether you're more interested in learning about EVM, what it is, what is a cIP, what are the benefits. I think we're going to have a mixture of high level and very technical questions, and I think that's very interesting to me to have that. What I'll do when I stop speaking, I'm going to start putting into the chat some of the websites and other online resources that we have to support all EVM and cIP activities. We have a page on the TechNet website it's called a hot topic, and you can find it in the menu, that has almost everything, every document and resource that's been released on relating to EVM and cIP. So if you're looking to track something down, that's the first place to start. We have resources available in English and French, and some in Russian as well. So please take a look there. We also have an EVM group. That's a community of practice on the TechNet website. If you look under community and groups, you can join that group and ask any follow-up questions you might have there. And we have a Telegram channel for EVM managers in particular. So I'll share all the links to those resources later. But before I pass over to Olamide, I just want to say that we really want to hear your opinions as well as your questions. I'd love to understand from my perspective as the EVM Secretariat, what are the areas relating to effective vaccine management assessments and cIP implementation that are least understood? What guidance can we HQ provide to help countries and individual facilities use EVM, adapt it to their needs, and implement successful cIPs to improve their supply chain performance? And on that last point, the pain points of EVM cIP, I'm really interested to hear from you all in that regard, what we can do to do a better job on our side. And with that, I'll pass over to my colleague Olamide.
No, thanks very much, Dan, and welcome again, everybody. And we're looking forward to seeing how this session format evolves over time. As Dan had said, what I'll add is we know that as we support countries and regions on the EVM and cIP, oftentimes the EVM assessment itself goes in somewhat smoothly. It would be nice to hear from participants, you all, from your respective countries. What can we do to catalyze the cIP process better, both quality cIP activities, but also efficient and timely approval by decision makers, but also the implementation of the cIPs, making sure that it forms the basis of resource mobilization and continuous improvement as it was designed in the EVM approach. So it will be good to hear from you all if there are interesting case studies, experiences from your countries, from you all's experience. It will be good to hear what are the pain points that are involved or that are present in the cIP process, so that we are able to support you better. We'll talk about some of the tools that are currently available But it will be interesting to hear from you all also. So I think we're looking forward to an exciting free discussion. So please continue to drop your comments or questions in the Q&A function just beside the share button. You see a question mark subsumed in a chat icon. So please drop your questions there and we can definitely come back to that. Dan, pass it back to you.
Yeah, thanks, Olamide. Okay, so to kick us off, we have a question from Hassan regarding to online bar of EVM2 data collection and data entry quality. How can it be ensured? And I think that's a question that was also one of the questions that was pre-submitted on our Google form, and I'll read that one out as well because I think we can answer those ones both at the same time. It was, what data quality assurance measures are used during EVM assessments to ensure the accuracy and reliability of results, such as supervision, audits, or data verification? So I think this is a really important topic, and it relates to how can we be confident in the EVM assessment findings, which is a crucial part because the cIP, the continuous improvement plan, that is developed based on the EVM assessment findings needs to be anchored in reality. So I think that's a really key question, and I think all of our panelists have our own perspectives on that. I have it from the tool perspective, Zainab and Erida from the EVM assessment delivery perspective. But I think Olamide, you wanted to come in first and foremost on this point, and then perhaps we can go to the other panelists. Olamide?
No, thanks, Dan. I think we can have Erida and Zainab jump in. But of course, right from default of developing the application and how the application is set out, data quality is thought about because that informs what is a reasonable sample in an EVM assessment. And of course, there are tools that have been developed to auto support after you do your assessment. You ensure that lead assessors are not always from that specific country. You mix around assessors to make sure that they're not assessing their own facilities, to make sure that there's some quality assurance in the process. But Zainab and then Erida can probably go to the specifics of some of the tools, assessment deliveries, and then,
Okay, thank you. Just to add on that, if I will just take you through the process of conducting a quality EVM assessment, I think one of the most important factors is choosing the right assessor, because conducting many assessments, we have seen assessors who are not into the cold chain, and then you have to start explaining the basics of vaccine management and cold chain, and this will definitely affect the quality of data. Someone who doesn't know a cold room, then how he is going to assess a cold room. After choosing the assessors and during data collection, whoever is doing data validation, which is the cleaning of the data, should be someone who is really into the system, who knows what is available there. Because if I know they don't have, for example, a remote temperature monitoring device, and there is an answer of yes, then I can identify this as an inconsistency. So data validation is another point of ensuring the quality. And for me also during the cIP itself, because in the cIP workshop, we usually present all the findings, and many times, if I can say all the time, we do find also inconsistencies in that one. That's why for me an EVM report is a draft until you finish the cIP, because you will have another round of adjusting, changing some of the answers to ensure the quality of the data. Of course, also supervision during the field, and maybe if I can say the most important for me is the quality of the assessors themselves. Over.
Erida, do you want to jump in?
Then, I will follow up. As Zainab mentioned, the most important part is who will be the assessor, which is really crucial. Then I will focus also a little bit on the training. So during that week, we have to make sure and understand that assessors understand very well and use all the features that the EVM tool offer. So even if in a field they might get lost, there are options to find the right information in order to provide the right answer. Also, as Zainab mentioned, we have had cases when there were people involved not dealing properly with the immunization. So for the reviewers, it was really difficult. But in this case, with this new tool, it's much easier than in the previous ones, what you had to go to each questionnaire in Excel or in printed files. Now answers can be seen. And something from the practical side I would like to add is when you decide to select people to visit locations, it will be better if you do not involve people that are supervising that area, that health facility, to be with the assessor, because sometimes they might affect a little the answering. So it's better to leave the assessors in a free discussion with the nurse, especially for the lower level in health facilities. So in most of the cases, we have tried to arrange different districts, assessing other districts, not their own district. This is also something that can help a lot. So I'm not going to add any more here because we have a lot to discuss.
Thanks, Erida. I think a couple of follow-ups from me. I see Hassan, you've raised your hand. Just I think we can hear from you in just a moment. I think summing up, this is actually there are quite a lot of strands here. You've touched on a really important point, and choosing the right assessor is one, as Zainab mentions. Making sure that they're the appropriate people and making sure that they're trained adequately, as Erida mentions. Also, we've worked very, very hard in EVM2 to ensure that the data collection is much more reliable in EVM1. We make sure that the questions are almost always binary. Many of them are auto-calculated based on repositories of cold chain equipment data that we maintain within the tool. And following that, it's standard that a data validation exercise takes place after all the data is collected. And then on top of that, coming towards the end, we have every questionnaire must be validated formally by the manager for that assessment. And then at the very, very end, if it's a national assessment, it must then be validated at the global level by the EVM Secretariat to ensure that the sample was correct. And I think there's a question around the sampling coming up later. And to ensure that the facilities that were assessed were appropriate to be designated as a national assessment there. I think we should move on to do we have a second question here? No. Yes, Alex.
This is Alex. Yeah, perhaps we wanted to give Hassan the possibility to ask his question, right?
Yes. How do I do that? Is that
Let
something
me do that. Okay, Hassan, if you want, you can speak. You just need to unmute yourself. Hassan, would you like to speak?
Hello, everybody. Do you hear me?
Yes, we can hear you loud and clear.
Hello, I'm Hassan from Iran. I'm cold chain manager. My question is that in EVM1, we have filled the hard copy to double checking if is needed. In the EVM2, as I know, the data will be collected online. How we can check it after enter?
Okay, so this is a question of how you can double check the quality of the data once it has been collected and uploaded.
And entered, collected and entered.
And collected and entered. Okay. Okay. Well, I think that the process prior to uploading onto the website, the data can be manipulated or entered on the EVM Assessor mobile app. Typically, that data is then reviewed by the manager for the country or the assessment, and check that the data is correct. And at that point, the data can be edited as necessary. And then, as I mentioned before, once all of the data is collected, typically all of the assessors reconvene and take 1 or 2 days to validate all of the questionnaires that have been uploaded. And of course, Zainab and Erida can talk more about this because they've conducted these in the past. But I think, no one is human. You can assume that there will always be some errors, but thankfully, because of the data validation tools that we have provided, outliers in the data can be fairly easily identified and errors corrected within that group during the data validation exercise. Perhaps does Zainab or Erida want to speak any further on that?
You mean we should have a real-time validation? The manager should have real-time validation of the data?
It doesn't have to be real time as such, because the only endpoint is when the assessment is marked as complete. Until then, all of the data can be reviewed and edited as necessary.
Okay, thank you.
Erida?
Yeah, just to add a little bit to make it more handful how it works. So in the previous EVM, we were waiting after 1 week for people to come back and bring the Excel forms printed or the Excel sheets in order to go over questions. With the new EVM, it's the possibility that they can be uploaded. The manager can review, not immediately, as Dan said, but during the week. And this questionnaire will be accepted or marked as completed only when it is really completed, data has been validated or double-checked. And there is the option for the assessor to correct and upload all the time until they submit the final version to be accepted in the end for the data validation of all over assessment. Over.
Thank you, Ida.
Thanks, Erida. Thanks, Hassan, for the excellent question. Okay, I see we have another question from Alexei. It's actually 1, 2, 3 questions, three for the price of 1. And I just read it. It's a great set of questions. How can we ensure that the EVM assessment is established as a core requirement for improving the performance of national immunization programs within health policy frameworks? I think that's a really great one. It's also more or less a political question and it relates also to other initiatives in this space. All the difficult questions I'm going to give to Olamide. Olamide?
So, no, thanks, Dan, and great question from Alexei. As Dan mentioned at the beginning, if we're conducting an EVM assessment only with the EVM report in mind, then we'll most likely be missing a lot of opportunities. But if we have from the beginning that continue to remind ourselves and stakeholders why we're conducting an EVM assessment, what would be the most important end goal, and how we can come together as a team to achieve that, then most likely will contribute to the bottom line. And that is actually the development and the tracking of the continuous improvement plans that are developed after an EVM assessment. So if you conduct an EVM assessment, the assessment itself over 2-3 months, and then the cIP is developed over a year, and it's even not finalized, then it shows the prioritization of the most important step of the continuous improvement process. The central piece also is to make sure that when you're developing your cIP, that it's not just a handful of colleagues that are in the room. You must reach further beyond immunization, but also decision makers, because you will need to go to them to negotiate resources for the immunization supply chain. So if you're only keeping it within the supply chain community, or the immunization supply chain community, then that would be counterproductive. So get folks from the broader health, broader immunization, broader health, but also resource mobilization folks, Ministry of Finance and all that. There will be some part of your EVM and your cIP that will touch on infrastructure buildings. So you want to start knocking on the doors of the works department to make sure that they are involved. They know what's happening. Maybe some resources you can leverage there or some skills. So that would be something that would recommend. Monitoring and ensuring that high income and upper middle income countries implement EVM assessments. We started discussing with colleagues in our regional and HQ update that perhaps rather than the linear process of conducting an EVM assessment and then developing a cIP, maybe we can turn it all around and say countries make assessments one way or another in supply chain, in immunization supply chains. Countries do snapshot quick assessment, or as part of some missions or equity assessment, they have supply chain recommendations. Can we start from there to have countries actually have a cIP, even if it's not after an EVM assessment, a cIP that's after, okay, you have activities, supply chain that you're implementing, and then they use that as a way of making stakeholders understand the value of assessing the supply chain, immunization supply chain in a systematic way. And hopefully that catalyzes interest in conducting EVM assessments. Frequency-wise, we typically recommend a range of 3 to 5 years, depending. We know that most countries edge towards the latter figure in the range, 5 years plus. And a few countries do every regular 3 years. A number of countries also do the midpoint 4 years. But targeted assessments are also important to bridge the gap between national assessments. And it doesn't have to be targeted assessments in everything or every month, but you can plan it in a strategic way to make sure that you are understanding the progress you're making and the bottlenecks or in specific supply chain functions.
Thanks, Olamide. I think you hit all three questions there. I think, yeah, excellent point about I would also add specifically where reference is made to the health policy frameworks. The key framework here would be the national immunization strategy that is typically provided, and positioning EVM often as an input to determining what the supply chain component of that cIP is going to be is really critical. And as Olamide says, it's the time frame of that is of the EVM itself, and the cIP is typically 3 to 5 years. The national immunization strategy is not always mandated within that framework. Returning to the middle question, I think is a really interesting one about ensuring high income and upper middle income countries consistently implement EVM assessments. I think it's a great question because conceptually EVM is and has always been intended as applying to every country, not focusing on low income, high income, middle income. It's all countries, because all vaccines need to effectively manage their vaccines through their supply chain. However, the implementation has been focused usually on LMICs, and this is where most EVM assessments are conducted. We've only had limited experience conducting full-scale national EVM assessments in high-income countries. But I've been trying for some time now to encourage national programs within high-income and upper middle-income countries to use EVM, because I think it would be very useful from my perspective to stress test the EVM framework to see whether it will provide the analysis and the correct insights that we think it would, as a one-size-fits-all framework for all countries. Alexei, did that answer all your questions? Oh, Olamide.
If I could add briefly, Dan, Alexei, thank you for that question again. If we go back to the health policy framework, So we're rethinking the cIP framework itself now to make sure that we strengthen the strategic component. Yeah, of course, also the operational component, but the strategic component. And like Dan mentioned, the NIS. So if the EVM is conducted and you develop a cIP, if you have a robust strategic component that has a vision for the supply chain, strategic objectives, and reasonable targets that you want to implement, then you would easily see an intersection between the cIP and other strategic documents where you can't list 50 activities or 100 targets, where you are only allowed to be quite specific and smart. So that's another way we would link, and hopefully sometimes in the next few quarters you would have the updated cIP guidance to flesh this out. Over.
Excellent. I'd like to go now to a pre-submitted question. I don't know who submitted it, but the question is, how are service points selected during national assessments? Is the sampling random, or is it based on probability proportional to the target population? Are the same facilities reassessed in multiple EVM rounds, or is a new sample drawn each time, for example, in Gavi-supported countries? I can make a first attempt at this one and then open it to the other panelists. The service points are selected during national assessments using a random sampling methodology that is actually exactly the same in EVM2 as it was in EVM1. So if you're familiar with that sampling, you'll know exactly how it works. The only difference being that in EVM1, it was a Microsoft Excel-based tool to do the sampling, and in EVM2, you use our website to do the sample. And how it works very, very generally is that you select your confidence and precision, and the sampling, yes, indeed, is proportional to the target population, but it's based on the lowest distribution level of the supply chain, the LD facilities that serve service provision clinics. And how that's done is you can find comprehensive information on the sampling that's used. There's a document that was written on this for EVM1, and I'll share the link to it in a minute in the chat, but it's exactly the same. And to the question within that, are the same facilities reassessed in multiple EVM rounds? The answer is no. They're not like what would you call them? Sentinel sites that are continuously assessed or periodically assessed. Each sample in an EVM assessment is entirely unique, and therefore the likelihood of the same facility, unless it's the national store or perhaps a provincial store, being included in successive EVM assessments is very slim. Although it does happen, of course, in very small countries, it could happen, but by and large, no, it doesn't happen. So a new sample is drawn each time there. So I think I don't know if anyone wants to add anything to that, or if hopefully I've covered it. No, okay. I think we've got one more question to everyone here in the chat. Olamide, do you want to have a go at that one?
In the chat? Not in the Q&A, yeah? In the chat.
Yeah, that's correct.
So perhaps we can read it. Dan, would you mind?
Yeah, sure. Thank you for such an explicit response, Olamide. You mentioned broader health perspectives for EVM. May I ask how better other stakeholders outside immunization programs can strategically be brought to centrally support? How do operational levels, i.e. districts, local government areas, be fully supported? I have this concern because everything ends at the operational level where the beneficiaries are found.
No, thanks for that, Dan, and thanks for the question. So again, one has to be deliberate in the engagement, and it has to be from the beginning of EVM assessment planning with the managers in the country. If we miss it at that opportunity, we continue to miss it. Of course, supply chain being regarded as an operation to support program in most in countries, we have to elevate the status of that. And how do you elevate the status of that? By ensuring that the National Logistics Working Group sort of is formalized, strengthened, engages broader decision makers on immunization supply chain matters, engages during development of strategic plans like the health sector development plans and all that, engaged during the national immunization strategy development. Now, those are avenues in which the voices need to be first heard before you then engage on what is important to you. Because if they are not heard at those times, your voice doesn't come to the table. It is relegated to only operations when you're required, you'll be called. I think that's extremely important. The opportunities of engaging stakeholders outside the EVM then comes when, you can always involve or invite top-level decision makers to open your assessor or your manager training. If you're doing it face-to-face in country, that's an opportunity. You give them 5 minutes to speak. They see what's going on. They stay for only 30 minutes and they go. That's a good opportunity to say, okay, the event we invited you to do the other time, we're having the results sharing exercise in a couple of months. We'll be inviting you again. But the cIP provides an opportunity to then actually dive into the detail, because remember, in developing your cIP, even though you have results from your EVMA forming a core ready subset for improvement planning, you bring in other perspectives, other strategies, findings from missions, evaluations beyond the EVM. And that could provide an opportunity to actually invite other sectors to come and present during the cIP development process at the beginning half or first day, where you are setting the scene, knowing the status of the health systems, the immunization program, the broader development sector. That's the time to actually invite stakeholders that are strategic enough to be able to explain. Now, as regards your question about lower levels, that's a fantastic point, and we talked about it earlier, that targeted assessments, actually, you can use that to actually strengthen the subnational engagement. Of course, in your national EVM, you would have to go to the field, engage lower subnational level management team and all that. But that could easily be a transaction, so to say. But when you strengthen in a strategic way the use of targeted assessment, and you build the capacity to be able to assess themselves, develop cIPs for themselves, and that's now possible with the SCIP platform. You can develop cIPs for each location in your country. And that is powerful enough to mean that if I'm the stakeholder in a district and you've trained me enough to conduct a targeted EVM assessment, developing a cIP for myself, I could do it. And then, yes, in your own national cIP, you would have activities that are relevant to my location, but in my cIP, it is 100% my district. So that way, you actually strengthen them to be able to use the EVM initiative to drive continuous improvement and that. So I hope I answered, was able to cover all your points there. But please, if anyone is outstanding, please come back. And then Dan, if you want to chime in, or Rita and Zainab.
I think you've answered it well. I mean, I always think of not including all the stakeholders within the cIP planning and implementation and monitoring process as a recipe for disaster. So it's always key to involve all the stakeholders, simply because the chances of failure of your improvement plan, if you don't involve the stakeholders from the beginning, is just so high. I put in the chat 3 questions that were asked online that were submitted prior to the call. I think Zainab, do you want to have a go at 1 or 2 of them?
Yes, thank you, Dan. So for the first one, does the tool assess or record information about the number and/or type of healthcare workers at each service point? Definitely, there is a section about the staff available at the facility, but those are only the immunization and vaccine management staff. So anyone who has any role in cold chain vaccine management is the one included in that list. We don't include the other staff, like, for example, nurses at different sections are not part of it. And there are some EVM recommendations for some tasks to be carried out by at least 2 staff. That's why we should include everyone, but it's only for immunization. The second one is about the GPS. If the GPS coordinates were recorded at the service point level in the EVM1 assessment. So if you recall, the EVM 1.0 data collection was done through the hard copy. So there was no recording for the GPS, unlike the new EVM 2.0, where you are using the app and you can locate that facility and the coordinates of the facility. The third one, I wanted to also to highlight on this because it is related also to the targeted assessment that Olamide was talking about earlier. How can I conduct a small community district EVMA, develop a cIP and monitoring implementation? Is there a tool to be used? How can we assess the tools? I think one of the challenges that we are having is managers are only at the national level. What we need to improve maybe at all countries is to have national managers at subnational and even district level. Because once we give those managers the accessibility on the website, then they will be able to conduct their own EVM assessments targeted. Even if not on the website, they can be trained on how to conduct their own EVM assessment. They can run both a random site selection or even a targeted one, and then they can develop their own cIP. So this one should be focused more on the training of the lower level managers, because as Olamide said, the cIP is a national one. It might not fix all the issues I'm having in my district. So I want to be more specific to have only the one relevant to my district. So this is doable, but it just needs a training and everyone can have accessibility for that one.
Thanks, Zainab. I think you've answered those well. On the last point about conducting a small community district EVMA, developing a cIP and monitoring the implementations, I think that I would say that from the beginning, EVM2 was designed so that it doesn't have to be only a national immunization program assessment tool. The same tool, the same methodology, the same philosophy can be applied to one single health clinic as an entire national program, meaning that we can treat one single health center as if it were the entire program. We can create a targeted assessment for that one facility. We can assess it, we can validate the data, and from that we can build a cIP, which we can then implement. And then once the health facility manager has implemented his or her improvement plan, they can then validate it with a follow-up targeted EVM assessment 6 months later or 12 months later or whatever it is. And all of those tools are available on the EVM website. There's no restriction on any of that. It's all open access. The only thing that is complicating matters, which unfortunately is a requirement of the WHO IT department, is that it's not possible to go to the EVM website and create an EVM account immediately. What you have to do is make a request to create an EVM account, and that's done. It's on the website, but basically you send an email to evmadmin@who.int, and then you will be an email will be sent to you with an invitation to create an EVM account. And then it's slightly annoying, that process, but we couldn't do anything about that, unfortunately, because the IT team told us we weren't allowed to have what's called business to consumer accounts. But so once you have that account, you have full range of conducting any assessment you wish for your own health facilities, and we call those my facilities. My facilities is essentially your own private country in which you can conduct any EVM activities or cIP activities you wish. Okay. Did anyone want to anything following up there from our panelists, or shall we move on to the next question? Next question, I think. Okay, so we have two open questions. The first from Shoang. If cluster for EVM is not fall in remote health centers, I think at least 3 to 4 additional health centers of remote area to be included during the EVM assessment. I think this is another very interesting one. I've got some comments, but I think other panelists might have something. Does any one of our panelists want to handle that one?
I think Zainab has indicated interest to chime in. Zainab, do you want to?
Yes. Thank you, Olamide Dan. So for this one, it is applicable to many countries. In many different scenarios, we don't only go with the national assessment, because sometimes countries would like to see the private sector, for example, but they don't want this private facility to be part of the national assessment. So usually we go for a targeted assessment where the manager of the country will choose a number of facilities to be assessed just for their own in order to assess the system at the private the same as the public. Another scenario is this one. For example, one of the provinces is not part of the assessment, and I really want to know how the system is running there. So either you can go with one targeted assessment, or you can generate another random selection for that specific province. It will be a subnational level assessment, and then you can get the data. The only thing here is that the recognize the global score of your country is the one that comes from the national assessment. For example, if you scored 76, 60, etc. But the one that you conducted for targeted, it will be part of your EVM report. It will be reflected in the cIP, but it will not be reflected in the overall score of the country. So one of the best features in the EVM 2.0 compared to the previous one, you can create different assessments in order to cover the needs of the country. The first one is random site selection, and then you can add as many targeted assessment as needed. Thank you. Over.
Thanks, Zainab. Olamide, anything on that one?
Well,
No?
I think no, but I guess the only thing to add would be that that could be something that will be discussed in the future to see how specific do we want to get to in this sampling. Do we want to stratify all health facilities or district by rural, urban? But again, let's not forget, with all this improvement we're seeking or trying to make sure it's more specific, the EVM2 application is still one of the most robust assessment tool that we have today in the development space. So yes, we can see what you're saying to say, okay, maybe we ensure we do a split of 40% urban, 60% rural in future iteration. But for now, we can use what Zainab said to have a dedicated targeted assessment for specific needs. And then that could be used to improve the cIP development.
Yeah, thanks, Olamide. I would add that the rules around the sampling methodology are necessarily strict, because we want to always be able to have a standardized yardstick to compare country scores over time. So what that means is that all countries must follow the standardized sampling process, which is population based. Therefore, remote scarcely populated areas may not necessarily are likely to be underrepresented in that sample as opposed to urban areas. And I think that's a case for ensuring that the equity zero dose agenda of the country is taken into account by considering whether accompanying assessments also need to be conducted, as Zainab mentioned. Or even simply for other reasons. We've had one country in the Afro region that wanted to have one facility assessed in every single one of its provinces and or states or counties, I can't remember, but there was something like 50 in the country, and a random sampling based on population will not guarantee you that one or more facility will be included in every one of these states. Therefore, what you do is you would create a targeted assessment for the areas not included within the national assessment, and include those results within your cIP. I'm aware we're only 10 minutes left. Time's moved on very quickly. I think there are two follow-up questions from Shoang. The request for a question to be included in the EVM questionnaire. Are there any challenges to maintain T-series vaccine during the winter season? I'm not sure about that one. I might have to get back to you on that. I can't remember what we have around let me get back to you on that. I see there was a question that covered something we already addressed earlier. How frequently do we need to conduct EVM assessments? I think we already covered that. We every 3 to 5 years for a national assessment is the recommended time frame, although targeted assessments can be conducted more frequently or as necessary by the country. Yeah, okay. I'm sort of losing track of the different comments here. Have I missed any of the streams of interactions we have? I wonder if we've answered all the questions correctly, or perhaps we need to go back on anything. If we do, please raise your hand.
Dan, if I could jump in, Mohammed is referring to, I think, the point you have made about site selection. Yes, Mohammed, if we, like has been explained before, if you want to do a national assessment and you want to use the platform for generating sample, it has to be follow the sampling methodology and process. You will not be able to just select it. You can select any facility, but that will be a targeted assessment, not a fully validated national assessment, because we don't want you to just select the facility, or you don't want me to select the facilities that I like for a national assessment, because that would give me a better result. But if you're in a district and you have 10 facilities, for example, you could do the assessment over the 10 facilities, and that will qualify for a good targeted assessment. So yeah, that's the deliberateness I was referring to earlier.
Thanks, Olamide, for the qualification. I don't think we have any new questions. I think maybe if we've only got a few minutes left, maybe I can ask our panelists the question, and perhaps just briefly tell us what I want the positive and the negative of the EVM tool. What do you like most about it, and what do you find most annoying or frustrating about it, and what would you like to be changed? Maybe Erida, can I start with you?
Yes, thank you. I like mostly the first part of your question because just I wanted to share with colleagues that this is really very practical, helpful, and avoiding these questionnaires in Excel and paper-based, it's really handy because you have it in your tablet or computer. It has questions that are really interactive. They allow you to see even some information. So if you are not sure of the question, there are some tips which helps you to go over and to understand better about the requirements. Also, you can have possibilities to upload photos and documents, which was not able previously with the Excel questionnaires. And what we like a lot is the heat map, because previously we were doing an assessment and we were leaving the facility with only some general comments, but now it's easy. You have the heat map, you show the answers and the scores, so it's very easy to identify immediately where are the weakest points. I can talk a lot, but one more thing is also the completion rate. which helps you to see the percentage of answering rate. Because what happened in the previous time, you might skip some questions waiting for some documents, and you could not go back to see if you completed everything. But there is the option when you see if you completed all the answers 100%. And I remember in one facility, we were just for a training, but the nurse did not allow me to leave that place because she wanted me to ask all the questions. She wanted all questions to be 100% because she wanted to see the scores. So these are more or less some of the things that I listed. Just for the accounts, the most difficult part, let's say, is when you ask people to create the account or send the email. You have to push them several times. Sometimes they leave this for the last day during the training. But I'll leave also the floor to Zainab since we don't have so much time. She can tell.
Thank you, Arida. I think I'm a big fan of the EVM 2.0 tool. This is a very user-friendly tool, especially for assessors, which are our data collectors. It has a very nice feature of capacity building because now with the new tool, for every single question, assessor can find online guidelines, some kind of explanation. So this will also be helpful for them during the data collection. The presentation of the data on the website is something we didn't have in the previous one. And currently, if you have more than one assessment, you are able to do a kind of comparison between the different criteria, categories, and you can identify the root causes of the issues, unlike previously. And it can be up to the national level. The program questionnaire, which is a new questionnaire for the EVM, I think this is the base of identifying your issues during the cIP. And then once you solve these, a lot of the operational functions will also be addressed. Another thing is that even if you don't have internet, we have conducted EVM assessment in countries with zero internet at different levels. There is a way of sharing the questionnaire, downloading in the app. The only time you need the internet is to download the app itself. But after that, you can manage without the internet. So this is a very nice also feature of it. I won't say something annoying, but definitely all assessors will say the questionnaire is very long. But it is long for a reason because we wanted to cover everything. So it's not just long because we like to ask a lot of questions. Maybe I would like to have for the report writing, because now we have just the results or the scores for every criteria and category. But it will be nice to work more on the report writing, to have one framework so that everyone is using the same template for report writing with some hints on how to fill in this part or this section. And definitely the cIP, although it's now have developed a lot with the new cIP tool, the new functions that we have, but some more need to be done related to the cIP. I can say maybe to ensure the implementation, the proper engagement during the cIP. This is the key, as Olamide said. And once you develop a cIP without the right people in the room, you won't be able to buy your cIP, to sell it to them because they were not part of it. Ownership was not there. So this is from my point of view, but in general, remember that EVM is a live tool. So whatever comes from the users, each and every time we are, the developers, they are improving, they are adding. So it's important to hear from everyone who has used that one. It will be an opportunity for a better tool in the future. Thank you.
Thanks so much, Zainab, for that. I have 1 minute left. Olamide, do you have any closing remarks?
No, thanks very much, Dan and Arida, Zainab. I think everyone for joining. I would say let's continue the conversation on TechNet. Send an email to us if you have any clarifications. For me, the greatest value of the EVM2, one of the very good values in addition to Arida and Zainab's point, is the fact that you can do targeted assessments and for not just national but subnational areas. It's a powerful addition. And with the cIP, as Zainab mentioned, that was definitely not as comprehensive before. But with the cIP tool now, you are able to develop track in a reasonably seamless fashion. So let's use all the tools we have to support improvement in countries.
Thanks, Olamide. And thanks everyone for joining us. Sorry, Ahmed, I don't think we're going to have time to take your raised hand, but please join the conversation on the TechNet group or the Telegram group, and we can answer any questions. And if you have any more questions, please keep the conversation going, because this is really, really useful to us to hear from you and hopefully transfer some of our knowledge and passion on this subject. So I think that's everything from me. I think, Alex, do you have anything more to say before we close this?
No, not much actually. Just repeating that we're going to send the recording to everyone, and we'll add some links to the relevant pages in case you want to join the group on TechNet, on Telegram, and so on and so forth. So you'll receive, everyone who registered will receive this email. Thank you so much.
Thanks, everyone.